Hello, everyone. Welcome to our Facebook Live on Calmare Scrambler Therapy. I'm Cindy Perlin. I'm the founder and SEO of the Alternative Pain Treatment Directory. And if you're not familiar with the directory, it's a website with information resources for people in pain. And I'm here with Laura Brown. Laura Brown is a physical therapist, massage therapist, and Calmare therapy practitioner. And hello, Laura. Thank you for joining us.
Hi there. Thanks for having me tonight.
So, can you tell us a little bit about your background and how you got interested in Calmare therapy?
Sure. I started in 1996 as a physical therapist, and I quickly went to outpatient physical therapy where I really enjoyed doing the hands-on work. And as I found myself doing less and less of that, I got a little bit disillusioned and I missed the hands-on work. So I thought, well, why don't I become a massage therapist? Because that's all we do. And I really enjoyed that so much, walking into a before picture and leaving the after picture there. It's really satisfying, but I always felt like I wanted to pull in more of the PT knowledge and skills. And one of my clients actually told me about Calmare therapy. His daughter had tried it in Connecticut, and he just talked a mile a minute about it. He really thought a lot about the therapy. And I thought, wow, this is something, this is the real deal. It's tackling some real pain issues from some really difficult neurological conditions. And, it was achieving things I just couldn't do with massage, or it would take me 900 sessions with massage. And Calmare is the fast track to living with a lot less pain. So I got really intrigued. I called the company to make sure that I could do this as a physical therapist. I was pretty sure I could, but I wanted to cover all my bases. And they said, yes, of course, a physical therapist can do this. So long story short, I got myself a machine and here we are.
And how long have you been doing it now?
I'm coming up on 5 years.
Oh, wow. Oh, okay. So, can you explain what Calmare Scrambler Therapy is and how it works?
Yeah, it's an FDA-approved electrotherapy device for neuropathic and oncologic pain, which is a nice way of saying nerve pain and cancer pain. So it's very gentle. It's just surface electrodes on the skin. It tingles, it hums, it vibrates. And what it's doing is sending in an artificial neuron to scramble the pain message into one of no pain. And it sends a no pain message to the brain instead of the pain message to the brain. And eventually that overrides and it becomes the dominant signal recognized by the brain. And it works beautifully. I'm really impressed with this therapy because we'll know in a few sessions if it's going to work or not.
Mm-hmm.
And you're only going to do it because it's a sure bet. So it's really cool. It's really amazing because I come from the background of PT where you send people home to do a home exercise program and you hope they're going to do it. You're relying on them to do it, but you have to strengthen and you have to stretch and all these things take time and you have to be very faithful to it to see the results. But with Calmare, we're seeing the results much, much faster. So it takes very little on part of the patient to follow through.
It sounds great. So what's the session like?
Our first session is a lot of talking. I actually do a consultation first. So before they even come into the office, we're going to have a pretty good feeling that they're a good candidate because we're going to go over contraindications. We're going to go over what medications they're on, what is their condition, and is it a good match for Calmare? So we've got that all out of the way. So by the time they come in, it's very simple. I have them interact with me. I palpate, they tell me where the pain is. Electrode placement in that first session is very important. So we're going to pretty much spend the time nailing that down, where we're putting those electrodes. And then are we getting the results that we want after we get them placed and turn the machine on? And if not, then we have to move them We might change the type of electrode, but we're just going to work on getting those results. And it's very easy. They'll come in. I'll ask them what is their best position, or what are they doing when they're in the least amount of pain, because their pain might not always be constant. It might be a 4 and it gets up to a 10. And they might say, well, I feel my best when I'm sitting off my feet with my feet up. So I'll put them in that position, and I'll try to get the pain down to 0 or as close to 0 as I can. Mm-hmm. And then once they've enjoyed that for a little while, we're going to start to introduce those movement patterns that cause the pain to increase, so that we can train their brain that they don't have pain no matter what they're doing. They should be able to walk and stand and do whatever they want without high levels of pain.
Wow. So how long are they in your office for a session usually?
An hour.
An hour? Oh, okay.
Yeah.
And what does a course of treatment look like over time? Like how many sessions over how long a time period?
It's very individualized. So that's a hard, I can't give anyone an exact number, but I have them anticipate 10 to 15 sessions. We're usually done in 10 to 15 sessions. 15 would be a lot. 15, you might have more than one body part being treated or a very wide area being treated. But yeah, expect 10 to 15 sessions, which usually by the time people find me and hear about Calmare, that's nothing. They've been suffering with that pain for so long. I say 10 to 15 sessions, and let's see what we can get it down to.
And that's usually over like 2 or 3 weeks.
Yes.
You want to do them right after the other.
I do. I want to see them Monday through Friday. Yeah.
Yeah. So when you say they're done, does that mean they don't have any pain anymore?
It's whatever their new normal is, and the goal is to have no pain at all. Yes. If somebody has come in at a 9 and we get them down to a 1 or 2, and they stay at that level for more than 48 hours and nothing I do changes that level, then they're done, and that's their new normal, which I'm still going to think is pretty good.
Yeah, going from a 9 to a 1 or 2 is pretty dramatic, and especially in the time period that you're talking about.
Yeah.
Without any drugs that they have to keep taking over and over again to maintain the effects. This is a change in the brain that lasts generally. Right?
Exactly. Yes, It does last. And that's the other thing people want to know, that I can't exactly put a number on. Some people are done for good and they never come back. Some people might need a booster session, anywhere from 1 to 3 booster sessions after 6 months to a year. And then maybe they never come back. And then everybody's a little bit different. So that's hard to say, but yeah, if they need a touch up once in a while, we call that a booster session. You come in, as long as you don't let that pain get back up to its original level.
Yeah.
Come in for that booster as soon as you start to feel that coming back in, then anywhere from 1 to 3 sessions, they're out the door again.
Yeah, that's pretty amazing.
Yeah.
I know enough about alternative medicine and how hard it is to get it out there and get it accepted, that I'm not surprised it hasn't really caught on. But on the other hand, I'm surprised it hasn't really caught on.
Yes.
So amazing, so dramatic. And when you think about, the kinds of things that conventional medicine tends to do for these chronic neuropathies, either, all kinds of medication every day causing all kinds of side effects, or God forbid, a spinal cord stimulator, which is a surgery and often fails and people have to have them removed and cost tens of thousands of dollars. With this, you're talking about something that can cause no harm. You do it and you're done. It doesn't leave this, device inside your body that could malfunction and make things worse. So, you wonder why, insurances haven't embraced this. It's kind of
I'm glad you say that, because it is the worst thing that can happen with Calmare is it doesn't help, but it can't make anything worse. So that's a wonderful thing. I mean, you're right where you started, and we just start thinking about other things then, but it can't make you worse. And why insurances don't reimburse it, I'm not entirely sure, because I think they need to grasp the larger picture about how this is going to save them money.
Mm-hmm.
In the long run, it's really going to save them money. People are out of work and wanting to go back to work. They're going to the doctors, they're paying co-pays, they're buying medications. They don't want to take medications. They're trying to avoid surgery. I can't tell you how many neuropathy patients I've seen that tell me they were told just to enjoy their time, they're going to end up in a wheelchair. And that's going to be that. And I get to look at them and say, not so fast. Let's just see about that. And
Yeah.
there's no wheelchair in their future.
Yeah. I know Thomas is saying that it should be mandatory that they try Calmare before they try a spinal cord stimulator. I mean, oftentimes, insurance companies have this step care requirement with drugs. We have to fail on the less expensive drug before they'll let you try the more expensive one. They ought to have this for something like this because, like you said, it can do no harm and it's so much less expensive.
Yeah, it is.
So it doesn't make any sense. So can you talk about some patients you've worked with and the kinds of results that they've gotten?
Sure. I've gotten some mostly neuropathy, foot neuropathy. I'm not sure I knew how many people have foot neuropathy out there, but I'm getting calls about that almost every week. Somebody with foot neuropathy, and they have very good results. But results are not always linear. What we're looking for is for the pain intensity to decrease and the relief period to increase. That's why it's not a one and done treatment. It's a series of treatments that build on each other. And hopefully if they're a 9 when they come in, then we want to see them come in at an 8, a 7, a 6. And if it lasted 2 hours, we want it to last 3 hours, 4 or 5 until they really don't need me anymore. That is the plan. But pain is really complicated. And people have what I'm running into more often than not is people can't really, they have a lot of trouble describing it to me. When they're on the machine, I need to know if we're on the right track. So I will ask them, is this getting better? Is nothing happening at all? Compared to when you came in, how are you feeling? And they really have a hard time assessing their own pain. And that surprised me. But it's so complicated. It's so wrapped up in so many different parts of our person. So it's really hard for them to tell me, but we have good results with neuropathy and Calmare. It's just maybe not linear. So there may be a day you come in, you're doing great. You're down to a 4 from a 9, and you might come in at a 6. And that's just par for the course. No getting discouraged allowed. We're on the right track. It's just a flare. It's just a bad day. They're not linear.
And many things can cause pain flares. Stress is a huge one. For some people, it's weather, overactivity. So
and our relief can look different too. It might not be a change in intensity. It might, the area might shrink. Or they might say, geez, I noticed I stood for an hour and made dinner before I had to sit down, and I can't stand more than 5 minutes. So It looks different. It can come in any different form. Some people can't wear their shoes and socks, and suddenly they're coming in, walking in with their shoes and socks on. So it looks different.
Yeah, that's pretty gratifying, though, to see those kinds of changes and to be on the other end of it, where you're the patient and you're seeing those kinds of changes. And so often I know when people come to me for neurofeedback and biofeedback that, sometimes they've been going 20, 30 years with chronic pain and nothing's helped. And no one's looked at, these kinds of out of the box, unconventional kinds of treatment. And a lot of what they've done has made things worse. So it's, it's great that you're out there doing that kind of thing. Someone is asking how much you charge for each treatment.
I have a consultation that I do, and then the initial session, I charge $150 for the initial session. So I tell people, look, it's going to cost you a night out to find out if this is going to help you or not, because we'll know quickly. And then the only reason you would get involved in the time commitment and the financial commitment is for a sure bet. So there's nothing to worry about. If it doesn't work, stop doing it,
Yeah.
So the initial I do that because in a perfect world, that would be day one. It'll work just fine, and that will be their day one, and we'll start from there. And I charge $250 a session.
Mm-hmm.
And if we decide by treatment 3, 4 that we're going to go ahead and do at least 10, then I will offer a package. So they'll save a little bit.
Yeah. Okay.
Yeah.
So it's going to cost for a full course of treatment for most people less than $2,500.
Yeah. Yeah.
For most people. Some people make more sessions. Some people, occasionally you see people who need less, I assume.
Yeah. Yep. I have people done in 6. Mm-hmm.
Yeah. Yeah. So are there any scientific studies about this?
Oh, yeah. Yeah. We've got a lot of them are done on chemotherapy-induced peripheral neuropathy, but we've got studies on cancer pain. I'm reading them right off my list here. General neuropathy, CRPS is another one that we see quite a bit. And that's really gratifying because there isn't a lot that helps people with CRPS. So when they get help, it's really gratifying to treat them. We've got shingles, radiculopathy, phantom limb, brachial plexus. We've got neuromyelitis optica, post-surgical pain, burn scar pain, and there's other conditions. And there are some pretty big medical centers that use Calmare Scrambler Therapy. So people could visit those sites and read up probably on even more studies like the Mayo Clinic and the Walter Reed, Johns Hopkins, the Joint Base Andrews of the Air Force. They all use Scrambler Therapy.
I know that the military has put a lot of effort into trying to find alternatives to opioids because so many military people and veterans have gotten addicted. So that's they are some of the VAs, for anyone who's listening and is a veteran, my understanding is that the VA hospitals are like little fiefdoms. So where one hospital might embrace it, another, refuses to have anything to do with it. So, and that's in general, for different treatments that are not your standard treatments. So, they may find that their hospital has it or not, and if it doesn't, it's time for some advocacy.
Yes.
As Thomas is pointing out that 20 million people in the US have neuropathy, and I'm sure just a tiny minuscule part of that population has even heard of Calmare therapy, much less, had an opportunity to get treatment. So I'm just wondering if there's anything else you'd like to add before we open it up to questions.
I would just say that the biggest frustration is that no one knows about it. My voice is very small in the din of everything, all the white noise out there of everybody that's going to help with pain. So I would just say that is probably the biggest problem. Once people know about it, they're upset. They're upset they didn't know before. But even doctors don't know about it, so they don't know to refer to it. So people need to spread the word. If they're excited about the treatment, if it's doing things for them, they need to let people know. Because
and I think as providers in general, alternative medicine providers, we need to do a better job of educating people. That's why I started the directory. So someone is asking how we find providers in our area. That is a good question. Sometimes they're hard to find, and there, unfortunately, aren't that many of them. So you were talking about something when we talked yesterday, Laura, about
yes.
Providers.
And that's pretty exciting. We're starting a member support network because most of us who bought a machine bought it and were told, here you go, good luck. And and when we found another practitioner to talk to, the common theme is it's over there sitting in the corner collecting dust, not being used, because we all have the same problems. Nobody knows about it. It's not covered by insurance. And everybody, when they use it, is marveled by it. But we don't have a community. So we're forming a community. And that's been really nice. The one thing I've always been missing is there's nobody to run to. when you need to talk to somebody about this treatment. I have this person and it's not really an on-label use. What do you think? Have you ever treated this? Because just because you get the machine and you're trained, you might not see a certain diagnosis for 2 years. So you might want to talk to somebody about treating it. And when you're in a big clinic with other physical therapists, you can do that all the time. And I didn't know what a luxury it was, because there's nobody, there's nobody in this area doing Calmare. So there's no one to talk to. So we are all getting together, trying to be a little bit more uniform. And I think when we are uniform with our treatment and we're all sharing our success tips, this is just going to elevate Scrambler therapy as a whole in this country for everyone. And I think you'll see more and more practitioners, because they are hard to find right now. Just just search in Google.
And Tom is posting calmare.com to find providers, which is the company website. I don't think that's a complete list, but it's some place to start.
Yeah, it's a starting point, but that list needs to be updated.
So in terms of the network that you're helping to develop, can patients go to that discussion or whatever and find providers on there, or how would that work for patients?
Patients could, it's actually a network for the practitioners to commiserate among themselves, share best practices, and share their tips and success stories. But there would be a comprehensive list of all the practitioners. So in that vein, I don't want to speak for the president of the network, but I don't think that would be a secret. I think we would.
So you're working on that. You're working on having a more comprehensive list.
More comprehensive list, yeah. But how I did a lot of that was just a cursory search. I'd say I started with Alabama and said Calmare therapy, Scrambler therapy in Alabama. And I found people that way. And
hopefully, people are who are doing it are putting it on their website so they can be found. There's a few providers, including Laura, on my website, which is paintreatmentdirectory.com. So that's another avenue. I see that Anne is saying, my thought is that this is not alternative, i.e. instead of Western medicine, but rather complementary, i.e. in addition to Western medicine. I would have to, disagree with that, because really Calmare therapy can solve the problem, where Western medicine can't. People who use Calmare therapy, and Laura, correct me if I'm wrong, they could stop using their medication. They can stop doing some of the other therapies that they're doing, and Calmare will solve the problem, because it gets to the root of the problem. The root of the problem is that the brain is sending a signal that's no longer needed, a pain signal. The tissues are healed. You don't have to protect them anymore, but the brain is saying, danger, 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 watch out. And what Calmare is doing, and correct me if I'm wrong, Laura, is saying, you don't need that anymore. Just shut up.
In its simplest terms, yes, that's what it's doing. But I think maybe it's a hybrid, because I can probably appreciate some of what she is saying there, because once the Calmare is over, it took care of the pain. I have a gentleman currently who his biggest complaint is his balance. And he has poor balance in part because he can't feel his feet. And something else Calmare has been known to do is not only get rid of pain, but if your feet are numb, it will bring the sensation back to them. So he's thinking that, if he gets the sensation back in his feet and he can feel when they're on the floor, he's not going to have as bad balance, which is true. However, does he not need more physical therapy? I wouldn't say that, because I'm sure there's some lack of muscle strength, and there's a lack of ankle mobility there. And those things need to be addressed too. So Calmare addresses the pain problem. If pain is your only problem, that's a beautiful thing. But I think in how she's saying maybe that it's complementary is because still we might need those other things. It does not eliminate the other side effects of having pain, like muscle guarding, avoidance of activity, atrophy, those things. So
Right. Yeah. I mean, a muscle that's not used because someone's in pain is going to be very weak, something they call atrophy. And you might need specific strengthening exercises to get back to things.
absolutely.
Yeah.
Yeah.
Yeah. Yeah. Does anybody else have any questions? So Don is asking, how does it work to block the pain?
It doesn't really block it. That's something that people are used to a TENS unit, and it actually changes the neuroplasticity of the brain by changing the signal being sent. It doesn't really block anything. It literally goes in and scrambles that message of pain into one of no pain. So it's like, I tell people to think of their brain as a computer, and it's stuck in an erroneous loop, and it's getting a bad feedback loop. And we're going to go in and fix what the computer is being told into the right code, not the erroneous code, if that helps.
Yeah. Yeah. I mean, the brain is always sending signals throughout the body. You know, when you move your fingers, you know, your brain is telling it to move your fingers, you know. So, you know, if it was telling your brain, your fingers to do something weird, you know, like stay clenched all the time, you know, you'd want to change that signal. So you're just telling the brain to do something different. And you're doing it with electrical signals, which, you know, I've been thinking a lot about this lately. The human body is really an electrical system. You know, we're used to thinking of it as a chemical system, but even more so, it's an electrical system with, you know, your nerves communicating with the brain through electrical signals. Your muscles have electrical activity. Your heart pumping, beating is an electrical activity. So I think that some of the most interesting and effective alternative therapies for pain have to do with working with those electrical signals. The other thing is magnetic fields, you know, pulsed electromagnetic frequency therapy, and light therapy, you know, is another therapy that works on some level of energy. So the body's an energy system, and if you can manipulate the energy, you can fix things.
Those are also treatments you could do along with Calmare.
Right. Yeah, I know, Laura, you've started to incorporate some different light therapy modalities.
I have the Origin light system, and I have an MLS laser, which is technically a cold laser, which I may pull out and use with the Calmare once in a while, or with massage, because it's really good at tackling inflammation. And inflammation can complicate our Calmare treatment, so we want to not do that.
Yeah, and light therapy, it's red and infrared light therapy at a certain you know, wavelength and intensity, and that's pretty amazing too. Not quite as amazing as Calmare. You know, it does work on a different level.
Calmare definitely has a wow factor.
Yeah. Light therapy, I mean, Calmare is mainly for neuropathic pain. Light therapy will work on joint pain, muscle pain also. And it helps with neuropathy, but not as dramatically as Calmare. Anna's asking where you're located.
I am located in Clifton Park, 963 Route 146, which is the Dorothy Lacombe office, and it's across from Shenandoah High School.
Yeah, that's in New York.
Yes.
Remember, we have a national audience here. So.
My apologies.
So, yeah, Clifton Park is what, about 20 miles north of New York? Something like that?
New York?
Yeah. I'm sorry, Albany.
Albany. Yeah. It's 20 miles north of Albany.
170 miles north.
3 hours north of New York.
So John is asking, why does inflammation get in the way of Calmare? If there's inflammation, then Calmare not be used?
I wouldn't say that they could not do Calmare.
It can be effective.
Right. Right.
It's just that the light therapy is just a little extra care.
Laser, I would want to throw laser on them as well.
Yeah. I see that so Laura is listed on the alternative pain treatment directory, and my assistant Charlena just posted the link to Laura's provider listing, which also links to her website. Any more questions, comments? What are the qualifications for professionals to use Calmare?
What are the qualifications needed?
Mm-hmm.
I would say that electrical stimulation has to be in their scope of practice,
Which would be
PTs, chiropractors,
MDs.
MDs, nurse practitioners. Yeah.
So like a massage therapist couldn't do it, wouldn't be considered qualified.
It's not in their scope of practice. They're working in a doctor's office, and they're overseen, and because everyone's trained to use it, and if they were overseen by the MD or the nurse practitioner, that's probably a non-issue.
Okay. And someone is asking, Kara's asking, if a nerve is cut, can the signal still get through?
You know what happens is the brain is very adaptable. So I think it wouldn't necessarily the cut nerve, but the brain will get some new pathways, some new neural pathways to overcome that.
When you're using Calmare or just in general?
Just in general.
So I would question if the nerve is cut and you're still in pain, and Kara, maybe you can respond to this. And I know that doctors are like, if they can't do anything else, they'll say, well, just cut the nerve. Are you still in pain with that cut nerve, Kara? So her response. No, that's Anne. Okay. I'm still waiting
I wonder if it was an ablation.
So John is posting that the FDA. So Kara is saying absolutely. She has a cut nerve, but she's still in pain. So still worth trying Calmare, because there's some other nerves they didn't cut that are sending pain signals, right? So John is posting that the FDA clearance for the device is as a doctor-prescribed treatment, according to the Calmare website. How do you get around not having the prescription?
I have direct access in New York State.
Yeah, I mean, I think, it's like I do biofeedback and neurofeedback, and there aren't any specific regulations related to biofeedback and neurofeedback that say that in order to provide it to a patient, I have to have a referral. I would think that Calmare is in that place of there aren't really any state regulations about it. It may be that the Calmare website is just saying that, it would be nice to have a doctor prescription to do it.
Yeah, and I wonder if it's something they have to say because they're selling nationwide. But in New York State, physical therapists have direct access to treat patients. So
Carrie's saying it's a surgery where they cut the nerve on purpose. That just seems like such a strange thing. I was at my chiropractor's office a couple of weeks ago, and a guy was leaving, and he said something about, so he was going to go have them cut the nerve in his arm. And I wanted to grab him and say, don't do it, because it just seems like, such a useless and potentially harmful thing to do. Yeah. I doubt that it, that it will solve the problem to do that.
They sound like they're at their wits' end and they don't know what else is out there. Everybody's tried everything, but they don't know there's the end of everything they haven't reached it yet. So,
yeah, I mean, doctors have a very small toolkit, and, it's basically prescription drugs and surgery. And, when they run out of that, or they sometimes, they'll prescribe medications that aren't approved for the pain condition. They will, come up with these crazy ideas about surgeries. I mean, I was surprised. I wrote a book a few years back called The Truth About Chronic Pain Treatments. And one of the things I was astounded to discover is that unlike drugs that have to be approved by the FDA, surgeries don't need any kind of pre-approval process. What happens with surgeries is a surgeon decides to try something, and he may tell the patient he's experimenting or not. And if the surgeon likes the result, he'll tell other surgeons and they'll try it too. And, when surgeons start talking about, I did this and whatever, I got good results, then other surgeons start doing it. There's, most of the surgical procedures out there have never been subject to any kind of clinical trial to see if they work. They usually only get that after, they're in widespread use, and then someone starts wondering. And most of the surgeries that are out there, tend to do more harm than good. There's an article on my website about that, in terms of all these surgeries not being clinically validated and just being out there. And then when they finally do the evaluations, they find out that they don't really do any good and that people are often worse off. So Tom is saying all kinds of doctors have purchased Calmare, including neurologists, anesthesiologists, podiatrists, MDs, DOs, PAs, chiropractors, nurse practitioners, and PTs. So I would say most of those are doctors, but some of those are non-MD healthcare professionals. So
I'm sorry, what did they say, that they prescribe it?
No, just that they've purchased it.
Oh, yeah.
So there are all these people, Tom. We got to find all these doctors who are out there doing it, because more people need to know about it and access this treatment. So the machine won't be sold to just anybody. It needs to be sold to someone who's qualified. And if you're looking for someone to do the treatment with you, you want to look at what their background and training is, and make sure you're comfortable with that. So Tom is posting, I don't care what your qualifications are. If you don't have Calmare, you won't get the best result. You need the right tool. The best doctor with the wrong tool is no good. I would have to agree that the best doctor with the wrong tool is no good. I was just reading an article. It was in Reader's Digest of all places, but it was talking about, these doctors who are out there and they're so disillusioned with the profession. They can't really act as healers because of all the constraints on them. One of my friends just told me that she has a new doctor because has retired, and that the doctor told her that she's not allowed to talk about holistic medicine to the patients. She's a new doctor in the practice, and they said, you can't talk about this other stuff. So that's the kind of environment a lot of doctors are practicing in. Even if they don't want to be that way, the conditions of their employment are that way. Anne is asking, so Calmare will be effective if neuroplasticity has developed. So neuroplasticity is something your brain has, right? Laura, do you want to speak to that?
Yes, it's the ability to adapt to changes in your body's environment. So we have that, and it's an amazing thing. It's why we can train the brain that, okay, now that you're sitting and you have no pain, we're going to get you to stand up and bend over and touch your toes and really aggravate the pain and train and make that pain go away. So it's the ability of the brain to be fluid and change and adapt to changes in your body.
Yeah, it's only the last 10 or 15 years that conventional science has accepted that the brain can change, once you're an adult, which is what they call neuroplasticity. And it doesn't make any sense that science was stuck in the idea that the brain didn't change, because how do you learn? I mean, if the brain can't change, how do you learn something new? How do you learn a new skill? How do you make a new memory? those all require brain changes. Anything that you do repetitively, your brain learns, and it just becomes second nature.
Yeah, we have to relearn things sometimes. We have strokes and we have traumatic brain injuries, and we have to relearn to do things that we knew how to do. So it's amazing.
So any other questions or comments? So Laura, we posted your link to your provider directory listing on the alternative pain treatment provider directory. But do you want to give out your phone number also?
My phone number is 518-867-2262. And my website is laurabrownpt.com. And if you want to peruse and read a little bit, you can do that, or you can call me at 518-867-2262.
Great. And for anybody who's not familiar with the alternative pain treatment directory, that URL is paintreatmentdirectory.com. And there's lots of information about all kinds of treatments for all kinds of pain conditions. And also, what's better not to do. Yeah, so Tom says, this is a bold thing to say, but in my view, the medical profession is stuck in a bad rut. Drugs, injections, and surgery. Time for a healthy change, Calmare. So he's really a proponent. I think the thing is that our healthcare system is about profit, and these other things are highly profitable. The kinds of therapies like Calmare that take some hands-on time spent with the patient that you can't, mass produce in huge volume. They don't like that because they can't make billions of dollars on it. But it's really the time, it's really the time to change that. Anna's asking if patients with cardiac pacemakers can use Calmare.
Not recommended.
Yeah, I think that's true with any device that uses electrical signals, that people with pacemakers should avoid it because it can interfere with the pacemaker signal.
Yeah, we wouldn't want to chance that and find a problem the hard way.
Yeah, so I would say, look at some other treatments like the light therapy, like electromagnetic frequency therapy. You can't use biofeedback, neurofeedback, CBD,
laser,
which is an herb that's good for pain. So, there's a lot of other things. My website is devoted to a lot of other things.
Your website has practitioners and products on it. Just
right.
So
yeah.
People are aware of that.
Yeah, there's a lot of good products on there, a lot of other practitioners, and over 350 blogs about different things. So, I'm just very impressed with Calmare and the speed and effectiveness of the treatment. But, it doesn't treat everything. And, there are a few contraindications. Are there any other contraindications besides pacemakers? And what about spinal cord stimulators? Because I've heard that, if they're not on, can you do it?
It's not recommended.
Yeah.
Yeah, there's other wires in the body that we don't know how the electricity will interact with that. But other things are okay. Joint replacements, that kind of metal is fine, but not pacemakers or spinal cord stimulators. Unfortunately, those are the big two. But I would just like to say that the more we learn, it's not been here. It's been here, but it's not been here in relation to other treatments. It hasn't been in this country a super long time when you look at other treatments. So people are using it and they're exploring it and they're finding out new things all the time. So I would say check back. I would say let's see what happens in the not too distant future. I know people are using it for musculoskeletal pain and having good results. So it's really an exciting time, and we need this network. We need to all get together and start talking to one another and help each other out, because some people are using it for joint pain, which I was told, you don't use this for joint pain. That's not what it's for.
Well,
Some people are doing it and having results. So I would say just keep your ears peeled.
yeah. So Marcy is asking, what's your success rate with idiopathic neuropathy and CRPS?
My overall, it's an 80 to 85% success rate. I would say my personal success rate is around 85%.
Okay. And people don't have to go through the whole treatment to know, the whole course to know if it's going to be successful. They
Right.
might stop after 1 or 2 because it doesn't look like, anything's going to work with it. Tom is posting that Calmare has never had an adverse event.
Right.
Anne is posting there are nerves innervating the joints, so that makes sense. So I think, with any pain that's been chronic, there's an element of the brain getting stuck in the pain, sending pain signals. They call it, the name, central sensitization. Sometimes I'm getting older, sometimes I have word retrieval problems, but they call it central sensitization, where, even with back pain, and I work with this with neurofeedback. I had a guy come in 12 years post-injury with back pain. A piece of industrial equipment had fell on him and crushed his back. And he had back surgery, and, his back had healed, but he was still in pain. And we were able to, eliminate the pain with neurofeedback, which is another way of retraining the brain that's stuck on pain. So, even with an athletic injury or an accident injury, you can end up with pain that just persists even though your body's better. So that's the idea, is your body's better, but the brain is acting like it isn't. The brain didn't get that message that, what it's doing is no longer needed.
Mm-hmm.
So, anything else? Anybody have anything else?
Just that there's nothing to lose. I mean, you're only going to do this because it's working. If it's not working, we'll know. 1, 2, maybe 3 sessions. I mean, I don't even think it would take that long, and we'll know if it's working or not. If it's working, you're in it for the program, and it's going to pay off. So if it's not working, you don't do it, and we look for something else. Pain reprocessing therapy is a nice alternative option, and it's a good option when people have had an injury due to trauma and they're very emotional about their pain. It helps them control that, because Calmare can't help control the emotion. It can help control the pain, but sometimes you need both to conquer it. And Tom's right. You can't get worse with Calmare, so there's nothing to lose.
There's no side effects.
Nope.
Unlike any conventional medical treatment,
Nope.
There's no side effects. There's no harm done. You haven't, cut into the body. You haven't introduced, unrecognizable chemicals into the body. You're just sending a signal, a gentle signal. And these, when you use electrical signals for pain relief, they're tiny, tiny, tiny signals, in the microvolt range, generally speaking, in the thousandths of a volt. It's not like, a thunderbolt going through your body or anything like that.
No. Some people fall asleep. I mean, if it's the first relief you've had in a long time, you might fall asleep because it's very gentle.
Yeah. And it's, it's the kind of electrical signal that comes naturally to the body.
Mm-hmm.
You're not introducing anything strange to the body. So, well, thank you all for joining us. Thank you, Laura, for being with us. And
thanks for having me.
Yeah. And this is being recorded on Facebook and will be available if you know of other people who need to see and learn about this. So feel free to recommend it to other people who need it. And visit both our websites. And everybody have a good night.
Thank you.